Hello and welcome to this educational video. People want to be happy. People always want good things in their lives. But sometimes, somehow life doesn't turn out the way you want it to be. A person might fail in his examination, a person might lose his job, a person might go through a broken relationship, will suffer through a bad marriage. Such hardships make people, sad, dejected, lonely. They feel the sense of worthlessness. Lay people like us try to sum these emotions as depression. But really, what is depression? Is it more common in women? Is it more common in men? Is it only for the adults or the elderly, or is it observed even in children and adolescents? Is it a universal phenomenon? Is it seen in different parts of the world? Come, let us pose these questions to our expert.
Depression is a sustained experience of sadness. We all experience sadness due to various experiences that we have on a day-to-day basis. Sadness by itself is a normal emotion, just like happiness is a normal emotion. When you experience positive things in life, you feel happy. When you experience negative things, disappointments, or other difficulties in life, it is natural that we all feel sad. So that is a normal emotion. But when does it become a clinical disorder which we refer to as depression? That is when the sadness persists along with a few other symptoms which cause a substantial difficulty for the individual, causing disturbance in his functioning. So this is what we refer to clinically as a depressive disorder. There are three most characteristic symptoms of depression. One is an experience of persistent sadness, which is persistent throughout the day or majority of the time during the day. The second is a reduction or a decrease in the interest that the individual has on various day-to-day activities that used to provide a lot of happiness for the individual in the past. The third is a feeling of sustained lack of energy or a feeling of being tired all the time. Along with the characteristic symptoms of depression that I just referred to, the individual may also have a lack of attention and concentration. The individual may have negative thoughts about himself or herself. The individual might think that the future is bleak and pessimistic. The individual might feel that there is no point living and might attempt suicide. The individual may also have difficulties with getting into sleep, or the individual might wake up much earlier than his or her usual wake-up time. The individual may lose the appetite, and therefore it might result in substantial reduction of weight. When the individual shows the characteristic symptoms of depression, namely sustained low mood, decreased interest, and excessive fatigue, along with the other symptoms of depression that I was referring to, over a persistent period of at least 2 weeks, that is when the psychiatrist would consider that the individual may be suffering from a clinical depression which would require interventions. The most typical psychiatric disorder which presents with depression is referred to as the major depressive disorder. The nature of this major depressive disorder is that it occurs in episodes lasting anywhere between 6 months to a year if left untreated. Apart from this major depressive disorder, or otherwise referred to as recurrent depressive disorder, depression can occur as part of another type of mood disorder referred to as bipolar affective disorder. This is a condition wherein you have episodes of excitement alternating with episodes of depression. The third type of depression is referred to as dysthymia, wherein the individual suffers from a sustained low mood, which may not be as severe as the depression that is experienced in individuals with major depressive disorder. Depression can also occur as part of other psychiatric conditions, for example, obsessive compulsive disorder, schizophrenia, other anxiety disorders, and so on. Depression is also experienced by individuals who suffer from long-standing medical conditions. Depression is also a part of individuals, a symptom that is seen in individuals who abuse substances over a long period of time, or individuals who are dependent on various drugs of abuse. So there are certain important regions of the brain which require to function normally for all of us to experience normal emotions. Particularly regions in the frontal lobe and the temporal lobe of the brain have to be adequately and healthily connected for us to experience normal emotions. And these connections are achieved by certain brain chemicals. To name a few: serotonin, norepinephrine, dopamine, glutamate, and so on. Now, in certain individuals, there could be an abnormality of these neurochemicals which lead to a problem with the connections between these brain regions in the frontal and temporal lobes of the brain. This could result in an experience of depression. In vulnerable individuals who could develop depression, these neurochemical abnormalities are known to be caused by certain abnormalities in their genetic structure. Now, what are the exact abnormalities in the genetic structure is something that is currently being researched by researchers all over the world. However, we know that these genetic abnormalities cause abnormalities in the brain signaling between these networks, which causes depression. Now, these vulnerable individuals might develop depression when they might be exposed to significant stressful events in their life, when they might be exposed to other medical conditions, when they suffer from other psychiatric conditions, when they use substances of abuse which can lead to abnormalities of signaling causing depression, or when they might go through difficult situations in their life, or during postpartum period, for example, after delivery, individuals who are susceptible for developing depression might develop depression.
Thank you for watching this episode in our series on depression. Today we learnt about the definition of depression, different kinds of depression, symptoms, how is depression diagnosed, and what are the causes that lead to depression. Thank you. Namaste.